Hi, today we will read about bronchiectasis, permanent dilation of the bronchi, which are the large airways transport air to the lungs. Damage to the airway disease characterized by airways abnormally distended. This causes the clinical features of SHIT. S stands for sputum, H stands for hemoptysis, I for infection, and T for tenacious cough. Pathogenesis. Bronchial dilation is the chronic inflammation triggered by pathogens colonizing in airways. This increases the mucus production and bronchial damage, which serves in ideal for further infection. Consequently, infections causes damage to airways, causes inflammation, which causes for further infection. Etiology. Keywords to remember: AABBCC. A stands for 1. Antitrypsin deficiency, asthma, bacterial infection, bronchial obstruction, cystic fibrosis, COPD, and others idiopathologic reasons: pneumonia, tuberculosis, connective tissue disorders, that is cystic fibrosis, and yellow nail syndrome. Clinical features: S stands for excessive sputum production, mucopurulent secretions on daily basis. H stands for hemoptysis, mild hemoptysis. Almost 50% of patients have hemoptysis. Massive bleeding is occur in later complication. I for infective exacerbations, sputum volume is increased and sputum purulence also increased. T stands for tenacious chronic cough, especially when patient lying down flat or on the sides, and clubbing of fingernails. Symptoms: shortness of breath, chronic productive cough, recurrent chest infection, and weight loss. Signs: you can find the sputum pot by the side of the bed. Oxygen therapy will be ongoing. Weight loss, cachexia, finger clubbing, car pulmonale with peripheral edema and increased jugular pressure. Scattered crackles, wheezes present on auscultation. Investigations: sputum culture. Most causative organism is Haemophilus influenza, Pseudomonas aeruginosa. Chest X-ray reveals tram track opacities, which are side view of the dilated airway. Ring shadows, dilated airways at the end of the tube. HRCT, high resolution computed tomography, is the gold standard for diagnosis. Bronchial diameter which exceeds adjacent vessel, increased bronchoarterial ratio which objectively demonstrate abnormal dilatation. Management: general management, vaccine against pneumococcal infection and influenza, chest physiotherapy, pulmonary rehabilitation to strengthen the lung and the muscles around the lungs. Long-term antibiotics needed. Steroids also prescribed. Inhaled colistin using for Pseudomonas. Long-acting bronchodilators also used. Long-term oxygen therapy. Surgical lung resection also needed to remove the diseased area and to help the healthy lung area to function better. That will be in last stage. Lung transplant also at the end stage of the disease. In infective exacerbations, according to sputum culture, extended course of antibiotics for 7 to 14 days. Ciprofloxacin for Pseudomonas aeruginosa. Key points to remember: clubbing of finger, diagnosis by HRCT, Pseudomonas colonization, and antibiotics for 7 to 14 days. Thank you.